Vanessa, it's Dr. Nitch, and this is your video feedback. So I think I'm giving the feedback just on the who am I assignment because it directly feeds into the draft this week. So you can think about how you can utilize some of this for the draft. So you have a lot of values in play here for sure. I need you to dive deeper into when it's hard, when you aren't going to be patient, when you're not going to be kind. And if you're working security now in a hospital, that's really hard. So I don't know if that's you're aspiring to work security in a hospital or that's currently what you're doing. It sounds like it's currently what you're doing. I don't know. I don't remember if that's where you want to end, what your end point is. But for example, probably an easy way to think through some messiness is the challenge of being kind when someone is not being kind to you. So, if you're working security, you're often called in when people are at their worst, right? So, when people are in distress, or if somebody is mentally ill or neurodiverse, when they're really struggling with illness, it's a very stressful situation, right? Because there could be violence, there could be other problems. So it's really hard to be kind when someone is scary, right? When somebody is making you afraid for your well being or the well being of people who are in your care. It's also hard to be kind when somebody is being, you're a woman, if someone's being sexist, if someone is being racist to you, if someone's being homophobic, depending on your identity. If someone's being shitty to you, making assumptions about you, treating you badly, it's really hard to be nice, right? So for the paper, take one of these values that are often tested in healthcare. Kindness is tested, patience is tested, respect is tested. When patients are not kind or respectful back, right, which can happen a lot. And is something maybe you've already experienced. So do a deeper dive into that so that you have something a little bit more interesting to work with. I think the model is going to help you see how to do that. So this person, notes how Christianity is important to them and how it's really helped them, be a good person and a good worker. But then getting real honest about when those values are going to get in the way, right? With a very specific example about transgender people or queer people. So you want to go there. So if it's for you, given the work that you're doing, if it makes sense to think about a patient who is not going to be nice, and you can, I'm sure, find examples of that from work, if the not niceness felt like it was tied to your identity or it was just tied to this person's, what they were, their state of being or their result of distress, but it was scary or it was offensive, those are times typically where most people just aren't going to be nice back, right? And that's sort of a normal. So then how do you manage that, right? Like, how do you not ignore your being offended or your fear, but still do what you need to do? So that's where I want you to go into that sort of messy area. This isn't terribly messy, right? And you want this to be a little bit more messy. If you don't feel comfortable putting that on the discussion board, just feel free to email it to me. So you're going to draft this essay after you annotate the model. You're going to look at a strong one and a not so strong one, so you have a sense of where you're going. You don't have to write a strong first draft, so no pressure there. It can be incomplete. It can be messy, or not. It can be not very messy, not messy enough. You'll get feedback from me Monday, and then you will have the week to revise, to write the essay that you feel good about. If at any point you have questions, don't hesitate to ask. Thanks, Vanessa.